Good afternoon. Today is Tuesday, October 13th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me again today is Diane Oldenburg, Senior Public Health Educator for the Oswego County Health Department. The County Legislature will hold its monthly meeting this Thursday. The COVID pandemic continues to have a significant impact on county government operations. The loss of revenue caused by the pandemic is the most critical factor we face as we develop the 2021 county budget. Early on in the pandemic, the legislature established a COVID response account to fund and track county expenses necessary for COVID-19 response activities. So far, the legislature has allocated $800,000 to pay for COVID response. Most of that money has been spent, and on Thursday, legislators will vote to transfer another $200,000 to the account. Under New York State public health law, the Health Department is the sole local public health authority regarding the COVID-19 pandemic response, but COVID has affected all departmental budgets. Expenses have included personal protective equipment for county and local response agencies, COVID expenses incurred in health, public information, emergency management, sheriff, and other departments, personnel costs, technology for remote work, services and meetings, and quarantine and isolation expenses. County departments continue to provide their core services while assisting in COVID response. Recently, the Department of Social Services was awarded a grant from the Federal CARES Act to help people who are homeless due to COVID-19. If approved by the legislature this week, DSS will be able to hire 2 temporary social welfare examiners to help homeless people and get them into more permanent housing. The temporary positions will be eliminated when all the grant funding is spent. The legislature will also vote on approving a grant to pay for additional health investigators to help with COVID-19 contact tracing. They will coordinate with the state health department and help existing staff monitor cases and contacts. And now I'll ask Diane to report on the health department's monitoring activities and the test results.
Thank you, Mr. Chairman. Recently, we've seen increased cases of COVID-19 among adults across the county, many of which are not related to school or college activities. The Health Department is monitoring disease activity to identify trends in any age group or population within the county. As schools are reopening, many kids may need to get tested. It's very important that parents keep their children home if they aren't feeling well, and that students and school staff follow the return to school protocols required by their schools and the New York State Health Department after being out of school with COVID-like symptoms. There are some seasonal communicable diseases going around in addition to coronavirus, and it's important for people to contact their doctor if they are sick before just getting tested for COVID. There are a variety of testing options available in the county. Sites operated by Oswego Health in Central Square, Fulton, and Oswego require a doctor's order and appointment. WellNow and Pulaski Urgent Care do not require a doctor's order, but require an appointment. More details on testing sites are available on the Health Department website at health.oswegocounty.com. It's very important that everyone maintains preventive practices such as hand washing, face masking, and social distancing. These measures will also help prevent infections from seasonal influenza as well. This year, it's more important than ever to get a flu shot. Getting a flu shot not only protects you and your family from flu, it can help reduce the burden on our healthcare systems responding to the COVID-19 pandemic. The Centers for Disease Control recommends that anyone aged 6 months of age or older receive flu vaccine. The Health Department is scheduling appointments for flu shots on Monday, Wednesday, and Fridays. Please call 315-349-3547 to schedule a time. For this week's test result, the 7-day rolling average of people testing positive for COVID-19 in Oswego County is still 1%. We've had 54,457 tests done. We have 703 positive cases. We have 40 active cases. We've had 659 patients released from isolation. We have 4 deaths related to COVID. We have 53,612 negative tests reported, and we have 195 residents currently on mandatory isolation or quarantine. Antibody testing continues, and our rate of infection remains steady at 2.4%. We've had 85 positive antibody test results in the county, with 3,411 negative test results. A total of 3,496 antibody test results have been reported to the County Health Department. We continue to staff our COVID-19 hotline on weekdays. Anyone with questions can call the hotline at 315-349-3330 Monday through Friday between 8:30 and 4 p.m. Thank you.
Thank you, Diane. This past Saturday, our health department conducted a DriveThru Flu Clinic as part of its Public Health Emergency Preparedness grant requirements from New York State. The purpose of the exercise was to prove the county's ability to conduct a clinic when the COVID-19 vaccine becomes available. The exercise was targeted toward the at-risk population and was held at the County Highway Garage in Scriba. Staff members from the Emergency Management Office, the Highway Department, the Sheriff's Office, Buildings and Grounds, Public Information, the IT Department, student interns, and Health Department staff from all divisions participated. This is just another example of the hard work going on behind the scenes and partnerships between the county departments responding to COVID-19. Again, I want to thank all of our employees for working together to help keep our communities safe. And thank you to our residents and businesses who are following the Health Department guidelines and doing your part to prevent the spread of COVID-19. Be safe and be well. You are making a difference.